Please.
Okay, guys, thank you very much. I hope you all had a good time. So before we go on to the last session, we would just like 2 words with you. So in the morning, I had asked you regarding your expectations. We are almost done with the workshop except for one session left. So I would like anyone, any 2 or 3 of you who would tell us, give us the feedback regarding the workshop. Did you find it up to the expectations? Do you want anything to be changed? And were your expectations met at the end of the day or not? Anyone who would like to speak, or 2 or 3 of you? We would suggest any changes that you would like us to make in our future workshops. So can we start with Dr. Kanaya and then give mic to our colleague over there?
And mainly the time is very short.
Okay.
We can't do a procedure in 15 minutes. Even we can't start. And we are also 2 candidates on one station. The shortage of time and some instruments are out of order.
So
That was
the
the main
instruments, what I understand, were working properly. The only thing was their maneuverability, which was a bit of a problem, what I saw on your station. As far as time is concerned, naturally, the idea is not for you people to complete the procedure as such, but to learn the basic method, how to do it. Naturally, you know, some people are fast, some are slow, some could pick things early, some would struggle a bit. Initially, all this happens. But the main purpose was to give you give you an idea what the basic principle is. And naturally, you'll go back and practice it. So you learn a lot with practice. Having said that, we can look at increasing the time, like 15 minutes to 20 minutes in our future workshops. This is something that we need to sit and, you know, work out the time factor. Yes, that's point well taken. Up, Doctor? Okay, so you thought the time was not. But overall, did you people learn regarding the content? Did you people learn or was it helpful? Was it not helpful? How do you feel about it? It was. Yes.
Struggling with the instruments in the patient while doing it wrongly, it was very good to have a right technique with right angulations and triangulations that have been told that help.
Okay, right. So this is very important. Remember, at the end of the workshop, the idea, the objective is not to make you experts, but to impart the correct technique methodology, and then you can go back and practice. Anyone else who would like to say something? From the resident side, R1s, R2, R3, R4s जो बैठे थे, who had attended this advanced laparoscopy workshop for the first time? Okay, can we have an feedback from you?
Madam, it was really helpful. The facilitators were friendly. They taught us in a very good environment. We enjoyed overall, learned the basic techniques. But of course, the time should be increased, I think.
Okay, so that's like lots of people have said that the time needs to be increased, so we'll look into it. Yes, there's this lady at the end, please.
The table heights were an issue since most of us are like what 5'1", 5'2", so the table height was very
So my dear,
inconvenient.
this we cannot predict unless we have now a pre-workshop form that would ask you what's your height and what's your weight. So this would be getting too much into it. So this is something that, you know, sometimes you work in an awkward situation, yes, but naturally you did not have your ergonomics right. But this, I think, it would be very difficult for us to do. Okay. So anything else? Yes? Yes, Harim.
Ma'am, I would like to suggest that before beginning the session individually for the practice session, if the instructor could be given 5 minutes separately to demonstrate it, because our instructor was doing that and it was very helpful for us. But it shortened the time at the end.
Yeah, it does.
But it was very helpful.
Yeah.
So if that could be...
So in our, I think, previously we used to do that, but today because of the short time and because they have squeezed in another 2 sessions for you, which we usually do not have in our workshop, and these are very, very informative, and I'm sure you'll feel really good after attending these 2 last sessions, which are usually not part of it. That is the reason we had cut down on the initial, but our usual workshops, we do demonstrate. So this is the reason this simulator over here is connected to the screen, because we demonstrate, because we were struggling for the time. So we decided, since each of the station had 2 facilitators, so we left it to them to sort that issue out. So they were supposed to demonstrate where you were struggling, which you are telling me your facilitator did. So this is how it should be. That is the reason we had kept one facilitators on 2 stations rather than keeping 1 on 4 stations, so they can give you a hand-on experience as well.
Thank you, ma'am.
Is that it? Thank you very much, and wish you all the best. So the take-home message is, please go back and keep on practicing.